Today's video will be on subtalar dislocation reduction and slab application. A 20-year-old female came to her ER with complaints of pain and swelling over the right ankle joint by twisting her foot while playing basketball. On examination, patient had deformity at the ankle joint. Patient could move her toes. The peripheral pulses, that is the dorsalis pedis and posterior tibial, were palpable. Saturation could be picked up from all the toe. There was no sensory deficit, and hence after giving adequate analgesia, we had planned on taking an X-ray of the right foot and ankle. So, X-ray right ankle joint, AP, lateral and oblique views were taken. X-ray had revealed a subtalar dislocation. So, we had planned on a closed reduction. So, after obtaining consent under procedural sedation, closed reduction using traction countertraction method was done. Traction was applied by one person and a counter traction force by the other person. Basically, the traction should be applied in a direction opposite to the mechanism of the injury. After the traction countertraction was applied, the dislocation was relocated. The limb should be placed in a neutral position. We will have to check for any vascular or neurological compromise had occurred during the reduction maneuver. So, dorsalis pedis, posterior tibial and anterior tibial pulses should be checked, and sensory deficit anything should also be checked for. Later, the limb has to be immobilized. Post reduction X-rays has to be done, and the post reduction X-rays had showed that the subtalar dislocation had relocated. Now the limb has to be immobilized in a POP slab. A below-knee slab has to be applied. For this, we require plaster of Paris bandage, cast padding and roller gauze. For adults, we use 15 cm width plaster of Paris bandage, and for children we use 10 cm width plaster of Paris bandage, and for the lower limb slabs we will use around 16 to 18 layers of plaster of Paris bandage for making the slab. We have to measure the length required and have to make around 16 to 18 layers of plaster of Paris bandage for making the slab. The slab should cover one joint above and one joint below. So, here we have to measure from below the knee joint till the metatarsal level. The toe should be kept free so that toe movement is not impaired. We have to adjust the length according to the length measured. Now, these 16 to 18 layers of plaster of Paris is made ready. First, we have to cover the limb with a cast padding. From the foot towards the knee, we will have to cover the padding first. It should be covered as each layer overlaps the other. And now we will have to prepare the POP. So, the 16 to 18 layer POP that we have taken should be dipped in water. It should be kept in water as long as the bubbles disappear. After that, we have to take it out of the water and let the water drip down. Once the water had almost dripped down, we have to squeeze it from above downwards and let the excess of water go out. Now the limb should be elevated by 1% and the slab should be applied. So the POP should be applied from the metatarsal level, that is leaving the toes free, and it should be immediately wrapped by soaked roller gauze. The soaked roller gauze should be wrapped from the toe towards the knee. Again, each layer covering about 2/3 of the previous layer. After the roller gauze has been wrapped around, keep the foot in the neutral position until the POP slab solidifies. Use 2 or 3 more layers of roller gauze above the padding, and you can tape it off with a piece of POP bandage. Once the slab has been applied, make sure that the limb is kept in a slightly elevated position, mostly on a pillow, and make sure that the patient is moving the toe frequently.